A special edition of Health Alert, COVID-19 post-pandemic progress.
Thank you for joining us for this special edition of Health Alert, COVID-19, the post-pandemic progress. I'm Rochelle Murcia. 5 years ago, COVID-19, also known as the coronavirus, upended the lives of millions of people across the world and here at home. Across Kern County, hundreds of thousands of cases were officially recorded by public health officials since the virus began to spread in 2020, and that number likely higher since the latest data only represents reported cases to the healthcare providers. Nearly 3,000 people in our area have lost their lives to the virus. Let's start with the origins of COVID-19. In late November of 2019, what was then described as a mysterious respiratory illness broke out in Wuhan, China. On December 31st of 2019, the U.S. Centers for Disease Control and Prevention started documenting what was happening there and reporting to the Department of Health and Human Services. It wasn't until January 20th of 2020 did health leaders detect the first human-to-human transmission of COVID-19. And that same day, the first case of coronavirus was detected in a 35-year-old man in Washington state who had just traveled from Wuhan. While this was all going on, our Kern County Public Department of Health was closely monitoring it all, trying to prepare for when this highly contagious virus would make its way to our home.
A lot of what really started was really starting in 2019, hence the name. And so we had been watching it very closely since about December.
Kimberly Hernandez, the Division Director of Health Services of Kern County Public Health, has been on the forefront of monitoring the coronavirus locally from the beginning, knowing the virus would inevitably make its way here.
And so it really was just kind of that matter of time of, when does it affect us at that local level? So I do remember, we were, communicating closely with all of the hospitals, particularly around our infectious disease doctors, of just be on the lookout. Tell us if you have any, if you have any suspicion. A lot of this was, again, looking at travel, as well as symptoms. But then we did get our first confirmed case, but we were bracing for it.
That was March 8th, 2020, just 4 days after Governor Gavin Newsom declared a state of emergency following the first death of the coronavirus in California. 3 days later, March 11th, the World Health Organization officially declared COVID-19 a pandemic.
And as we, notified the community, it says it's here. We've identified a person in our community who has been sick. It's sort of heightened awareness everywhere. It really had a lot of people concerned at that time because there were so many unknowns and a lot of confusion around it. And so a lot of what we were doing at Public Health was trying to really get information out to people. So this is what we know, this is what we need to do, these are the precautions we want people to take as we're still learning about it.
On March 16th, Kern County ordered a state of emergency and the Emergency Operations Center was activated to try and answer the many questions surrounding the virus. And more questions came, especially after Kern County schools stopped in-person learning, and a statewide shelter-in-place order is issued just days later.
Things like closing our schools had a huge impact on all of our families and all of our children. And that was something that at that time, everybody thought this was the way to keep our kids the safest.
While the quarantine was in effect, Kern County Public Health had to figure out a way to get people safely out, immunized and tested, turning the county fairgrounds into a mass rapid drive-through center. And it had to consider the safety of the county's frontline workers caring for those infected and sick.
Here at a local level, we never had the point where we were out of it. There were times where we were nervous. We were lucky that through the state, we were able to get PPE allocated to us. We worked, closely with our healthcare providers to get them stuff, when they were running low.
Now, 5 years later, Hernandez says what happened then has laid new groundwork for local healthcare and education moving forward. The COVID dashboard created to track daily COVID cases during the pandemic still exists, but now also tracks RSV and flu cases. And agencies, hospitals, and medical centers on every level that didn't used to reach out for guidance now comfortably do.
We learned a lot about communicating with our healthcare partners, and making sure we get them timely information, but also create that mechanism for them to ask questions. And that's, we opened up a lot of two-way communication that still exists today because, again, we were able to build relationships, and that people people now know people in these worlds, and that they can call upon them, and we respond to one another about what's going on.
And COVID created neighborhood canvassing. Kern County public health workers going door to door in our community, letting people know about their mobile health unit that is once again on the road following COVID. They inform people in person about health events, fitness, and nutrition, and answer any questions surrounding care.
People can ask those questions that they wouldn't want to ask in a group. And so, that's another really interesting thing that came out of our COVID-19 pandemic response, was understanding a little bit more how we still need to reach people, because we have lots of tools, but sometimes the old school way of just let's sit down and talk is very, very effective. As
well as knowledge, Hernandez believes the power of community caring came through during COVID and feels it's something Kern County isn't immune to today.
Everybody, really worked to do their part, to do the best that they could, and, really showed how much they cared about our community. And while we suffered a lot during COVID-19, there's a lot of hardship that happened, a lot of tragedy that did happen. There's a lot of beautiful things that came out of it too.
Just a few weeks into the virus spreading here in Kern County, the first death related to COVID-19 was reported in our area on March 27th, 2020. That victim, Susanna Garcia of Delano. Just 2 weeks after first experiencing symptoms she thought was just a seasonal allergy, Garcia died. Her son, Hector Garcia, spoke to us in 2020, just days after her passing.
She was the best mom. She could speak. She definitely wanted us to always have what's best in life and to push ourselves to be better and be better people in the community and in the world. My mom was loved by so many. She had so many friendships because of the people she met through her businesses that she had years ago. And she was always known for her bubbly personality and how well she got along with everybody. She was always the person that you wanted to be around.
Since Garcia's death, more than 2,600 people have died from COVID-19 in Kern County. Still ahead, local nursing homes were ravaged by the virus. One former skilled nursing facility especially hit hard. The significant impact COVID-19 had on elder care during the pandemic when we return.
Welcome back to a special edition of Health Alert, COVID-19 Post-Pandemic Progress.
Some of them at least get to talk to their parents through the window on the phone. My mom is hard of hearing, so I can't talk to her on the phone. And she's bedridden, so she can't come to the window. And I see her every day of my life. I'm not the only one. These people were brokenhearted, were devastated.
Who you just heard from there was the daughter of a Kingston Healthcare Center resident in 2020. The COVID crisis at the Bakersfield skilled nursing facility captured the state's attention. It saw a spike in coronavirus cases among its residents and care workers, putting elder care during the pandemic in the spotlight, and years later, ultimately bringing awareness to the assisted living standards.
Has anyone from Kingston told you that people in the facility are dying from the coronavirus?
Kingston has not told us anything that was going on.
Questions swirled around the Kingston Healthcare Center just months into the pandemic when an influx of patients and caregivers caught the coronavirus.
They were already in a downward trajectory, but COVID certainly kicked them off the cliff.
Matt Clark, managing partner with Chain Cone Clark, has represented families of loved ones who had been in the care of Kingston Healthcare Center even before the start of the pandemic.
Kingston had problems that predated COVID, right? They had problems with staffing. Their ratio of staff to patients was such that, at least in our opinion, they weren't able to provide appropriate care to their patients. And that's why they were having bad patient outcomes even before COVID came along. Of course, COVID was the straw that broke the camel's back for Kingston. I mean, that was the end of it, really, because they had already not had enough in the way of caregivers And then you combine that with the outbreak, and it was devastating.
That was a really sad time, in the COVID-19 pandemic. With Kingston, we learned a lot in that process. One being that, at a local level, public health is not a regulatory agency. We don't have enforcement capabilities. We don't have control, over what's happening in those facilities.
And fear of what was happening was growing with those who had loved ones there, especially after the skilled nursing facility's numerous previous health code and other violations resulted in heavy fines. In the face of a deadly and highly contagious pandemic, whistleblowers came forward, claiming the facility's lack of personal protection equipment, failure to properly quarantine those with the virus away from others, and lack of caregivers, some who would simply not show up, leaving the few remaining staff to care for the 180 residents. In May of 2020, Eyewitness News spoke to a family member of a Kingston caregiver.
She risking her life going up there in that facility to work for y'all. So y'all can't give her an extra mask? Come on now. Y'all, they don't care. I feel like they don't care nobody. They don't care about them clients, and they don't care about the CNAs.
People did reach out to us. We actually had whistleblowers reaching out to us. I remember specifically talking to a CNA from Kingston, a woman who was very fearful, not just for herself, but for her patients. Her claim was that Kingston wasn't providing the nurses and the actual people providing patient care with appropriate PPE, personal protective equipment, masks, gloves, the things that we all came to appreciate through COVID, weren't even being provided to the staff that was providing care. And so, of course, we all know in hindsight that Kingston had a COVID outbreak. They had some bad patient outcomes because of that. That
outcome led to COVID sickening 104 residents, 84 staff members, and ultimately the deaths of 19 people.
It was an uneasy era, right? What is the right advice? You have a loved one in a skilled nursing facility because they need skilled nursing care, and then the question was, do you pull them out? Do you keep them? What's the better outcome for that particular patient?
They are regulated at a state level. The state did have some involvement, but what we found was that we really needed to help at that local level. We really needed to provide guidance, support, PPE at that time.
Even with state and county health departments stepping in, Kingston Healthcare Center ultimately closed in February of 2022. Now 5 years of lessons learned later, Clark's believes this case has created a heightened awareness about skilled nursing and assisted living facilities, with more people doing their homework, looking at the facility's public rankings, and paying closer attention to the care their loved ones receive.
I think that post-COVID, post the good work that you folks have done in the media and in really bringing to light the issues in these facilities has caused people who are putting a loved one into one of these facilities to pay more attention. And really that's all you can ask, is pay more attention, be proactive, make sure your loved one is getting the care that they need and that they deserve.
Clark says he suggests to his clients and others to check out the CMS 5-star rating system. It's public data that ranks the assisted and skilled living facilities with hard data before you choose a place. To take a look at it, go to our website, BakersfieldNow.com. Coming up, COVID-19 changed the lives of millions across the world, and although devastating, it taught public health experts how to respond to future virus outbreaks. The lessons learned ahead. Welcome back. The COVID-19 pandemic led to a lot of devastation, but it also taught infectious disease experts a lot about how to respond to future pandemics. Michael Patterson has more from San Francisco about what one expert is reflecting on 5 years later.
For many, the COVID-19 pandemic is a thing of the past. March 2025 marking 5 years since California Governor Gavin Newsom issued the stay-at-home order, kicking off a dramatic years-long effort to combat the coronavirus. But according to Dr. Peter Chin-Hong, a professor of medicine and infectious disease specialist at UCSF, the scars of the pandemic still remain.
There's no memorial, there's no art installation. We're kind of just moving on to the next step, but we've all lost something. pandemics do end at some point, the population does get stronger.
Eyewitness News viewers may recognize Dr. Chin Hong as a regular fixture of our pandemic news coverage. Nearing the anniversary of the world-changing pandemic, we reconnected with him in San Francisco to reflect on the collective experience.
When you think back to the pandemic, 5 years ago, almost at this point, what are kind of the first things that come to your mind? What do you think about?
Well, I think about a lot of loss. There's a loss of lives, which is the easy thing to focus on, or hard, depending on your perspective. But also there's a loss of freedom, there's a loss of our way of life. I think we've had a lot of loss as a community, and we haven't really dealt with it.
While the pandemic is viewed mostly for its negative consequences, Dr. Chin Hong wants people to reflect on the early days of the pandemic and the sense of responsibility to help others during those days, a priority he feels many have lost in the years since the pandemic.
We watched out for each other. We, in the healthcare field, we asked our older faculty members and older clinicians to stay home, and we took up their slack because we were worried for them. I think we kind of lost that in a little bit, and we focused on loss of liberty, schools being closed, wearing that mask all the time. But there are a lot of things that we did that was good that came out of it.
Here at UCSF, infectious disease experts like Dr. Chin Hong watched as the pandemic moved into the Bay Area and the rest of the United States. And while the doctor believes the Bay Area responded well to the pandemic early on, it takes more than a regional response.
When you look at countries that did really well during the pandemic, like New Zealand or Taiwan or even Germany, they all had alignment too. They all had also the second thing, which is a strategy. So California can have all the strategy at once. If the United States doesn't have a really good strategy, we're not going to do well, and that's what happened.
Dr. Chin Hong says another major takeaway from the pandemic is how critical public health information is communicated on a massive scale. He believes that tailoring the message to the community that you're trying to talk to is a more effective way of getting the point across.
In many ways, the science was the easy part. We focused on the glistening mRNA vaccine or the at-home test you can do for COVID now. But you can have all the technology in the world, but it's not going to do you any good unless you intelligently and empathically implemented it in the populations that need it the most.
That also goes for how public health agencies may communicate with those skeptical about how the government is responding to a pandemic. Vaccine hesitation and resistance was high in the U.S. at many points during the pandemic, and Dr. Chin Hong believes the lack of nuance on all sides of the pandemic response hampered the way the U.S. responded to the coronavirus.
Reaching across the divide is what we have to do, and not anchored on both sides onto our positions, but seeing that there's truth in each position and understanding where that distrust comes from. The people on one side almost say that everything went right, and then the people on the other side almost say that everything went wrong, and the truth is probably somewhere in between.
And those lessons learned from the COVID-19 pandemic are being tested today. As the bird flu ravages wild and farm-raised bird populations, infects humans, and is leading to some higher prices at the grocery store, Dr. Chin Hong says the U.S. has been caught flat-footed because while we know much about the disease and have a vaccine to treat it already, it's still causing us problems. Dr. Chin Hong stressing that being proactive, not reactive, is the key.
Somebody once told me that that your prevention strategy or playbook works when nothing happens, because that's what prevention is about. Whereas when people say that nothing happened, they say, well, you wasted a lot of money, but that's when you know that something worked.
While it's been 5 years since the start of the COVID-19 pandemic, Dr. Chin Hong stresses that it is still important to reflect on the experiences so that we're all better prepared for future health crises. In San Francisco, I'm Michael Patterson reporting.
When we come back, COVID-19 changed the course of lives for many, but it also had its positive impacts, the changes some kept from the pandemic into their daily lives.
Welcome back to a special edition of Health Alert, COVID-19 Post-Pandemic Progress.
Finally tonight, while COVID-19 created many temporary changes to keep the virus from spreading, it also permanently altered many aspects of our lives. We were all forced to pivot, and some of those changes in direction have stayed, from sanitation, healthcare, and even the way some of us do our jobs. Sneezing, sniffles, and coughing, all signs of a common cold before COVID-19 came into our lives.
You know, we all used to cough in our hands, and after COVID-19 and all of the stress of coughing in your, coughing in your elbow or making sure you're using a tissue and throwing it away properly, I think that has been ingrained in all of us now.
The spread of germs was forced to the forefront with COVID. Hand washing and sterilization, hand sanitizer, rarely thought of 5 years ago, became one of the most on-demand items with the virus. Stores would sell out and we kept it everywhere we could. And it's still in many of those public places today.
The use of hand sanitizer is still very much around. You know, lots more people carry it with them. It's readily available in most public spaces that you go to. You know, things where, cart wipes in the grocery store, like all of those things have stayed. And so, increased hygiene everywhere is good for everyone.
Food deliveries, Uber Eats, Grubhub, and online shopping. All things existed before the pandemic, but not as widely and consistently used. Now the convenience is still commonplace.
I hear a lot of people say that, where we got used to things like, home delivery of lots of, of food, of groceries, and lots of online shopping that came out of that is still here today, and lots of people like it, can be very convenient.
Physical remnants of COVID-19 safety are still seen, like social distancing floor stickers, and sometimes a feeling to keep some space.
Some of us have, ingrained some of that, where maybe I just don't stand so close, or I don't like crowds as much.
And while there is no longer a mask mandate, more people are comfortable wearing them if they feel a cold coming on or under the weather. And workplaces seem more understanding if employees choose to stay home, not spread a sickness.
I'm going to protect my coworkers, I'm going to protect my customers, and that we have, we've been able to be okay with people doing that. We don't get people written up, for calling out sick from work. We're like, it's good for you to, if you're sick, stay home.
Speaking of work,
you said that COVID has changed your job. How has it changed your job as an attorney?
Up until COVID, I had never taken a deposition by Zoom before. It wasn't even really something that lawyers like me contemplated, right? If I had a deposition in Texas, I got on a plane, I flew to Texas, and I took the deposition.
Matt Clark, managing partner with Chain Cone Clark, says COVID-19 has altered his work, as it has many others with technology like Zoom and Skype, so often used during the pandemic. In-person meetings are not always needed.
I'm not a cat.
While we had to work out some of the kinks in the beginning, internet meetups have become the norm.
Very excited about representing the Central Valley.
We here at Eyewitness News use Zoom calls for many of our interviews. Businesses use them for clients and customers working from home. And attorneys like Clark use them in his line of work, saving time on travel and still effectively getting the job done.
Court appearances are almost exclusively remote now. It's rare, you'll walk into a courtroom and you'll be the only soul, not only the only person in the courtroom, you might be the only person in the courthouse, right? Because everybody is making remote appearances. And so it really changed the nature of the practice.
The practice of medicine also changed. Telemedicine became a vital tool in the pandemic. Seeing a doctor was a dial and monitor away, eliminating all risks of a physician's office and keeping our frontline workers safe while getting the care needed. It's a convenience that's still what the doctor ordered for many patients.
COVID forced that on a lot of places, and also created resources so that people could use things like telehealth, and a lot of us enjoy that now, that we can have a doctor's visit over the phone, or at least a follow-up over the phone, and that it's much more convenient, and it is something that those healthcare providers can now get reimbursed for, and so some things did move forward in that way. At Public Health, we got a lot of support in developing dashboards and data, and worked really hard on the way we get information out to people. So I think there's some positives that got pushed forward that were probably on their way, but the COVID-19 pandemic expedited it and made it much more available to the community at large, that we sometimes don't think about all of those other impacts.
That does it for our special tonight. Thank you for joining us, and from all of us here at Eyewitness News, good night.